Bismillah ar-Rahman ar-Rahim. This is the first lecture of gastrointestinal fistulas. Background: a fistula, a term derived from the Latin word for pipe. A fistula is an abnormal connection between two epithelialized surfaces that usually involves the gut and another hollow organ, such as the bladder, urethra, vagina, or other regions of the gastrointestinal tract. We are seeing here case of fistula between sigmoid colon and the bladder, but we are seeing here case of fistula between the rectum and urethra, and we are seeing here case of fistula between the rectum and vagina, and we are seeing here case the fistula between two lobes of the small intestine. Fistulas may also form between the gut and the skin, or between the gut and abscess cavity. Rarely fistulas arise between a vessel and the gut, resulting in profound gastrointestinal bleeding, which is a surgical emergency. We are seeing here case of aortoenteric fistula. Most gastrointestinal fistulas, 75 to 85%, occur as a complication of abdominal surgery. However, 15 to 25% of fistulas evolve spontaneously and are usually the result of intra-abdominal inflammation or infection. We are seeing here case of intracutaneous fistula in severely active Crohn's disease, but we are seeing here case of a midline intracutaneous fistula after abdominal surgery draining from the small bowel. Regardless of their cause, fistulas have a tremendous impact on patients and society: increased morbidity and mortality rates, greater healthcare costs for diagnosis and treatment, prolonged hospital stays, and delayed return to work are just a few direct consequences of this condition. I will talk now about causes of gastrointestinal fistulas. There are several different causes of gastrointestinal fistulas. They include: the first cause of gastrointestinal fistula is surgery complications. About 85 to 90% of gastrointestinal fistulas develop after intra-abdominal surgery. You are more likely to develop a fistula if you have cancer, radiation treatment to your abdomen, a bowel obstruction, surgical suture problems. We are seeing here long-term survival from gastrocolic fistula secondary to adenocarcinoma. And we are seeing here acquired gastrointestinal fistula. Incision site problems, an abscess, an infection, a hematoma, a blood clot under your skin, a tumor, malnutrition, The second cause of a gastrointestinal fistula is spontaneous gastrointestinal fistula formation. A spontaneous gastrointestinal fistula forms in about 10 to 15% of cases, often as a result of things like inflammatory bowel disease, malignant tumors, or bowel infections like diverticulitis. We are seeing here case of intracutaneous fistula in severely active Crohn's disease. And we are seeing here spontaneous intracutaneous fistula in an human immune deficiency virus positive patient. But we are seeing here case of sigmoid diverticulitis complicated by colophysical fistula presenting with pneumaturia. An inflammatory bowel disease such as Crohn's disease can also cause gastrointestinal fistulas. As many as 40% of people with the Crohn's disease develop a fistula at some point in their life. Vascular insufficiency, inadequate blood flow is another cause. The third cause of gastrointestinal fistula is trauma. Physical trauma such as gunshot or knife wounds that penetrate the abdomen can also cause a gastrointestinal fistula to develop. I will talk now about types of gastrointestinal fistulas. There are four main types of gastrointestinal fistulas. The first type of gastrointestinal fistula is intestinal fistula. With this form of fistula, gastrointestinal fluid leaks from one part of the intestine to other where the folds touch. The second type of gastrointestinal fistula is extraintestinal fistula. Extraintestinal fistula. This type of fistula occurs when gastrointestinal fluid leaks from your intestine to your other organs, such as your bladder, lungs, or vascular system. The third type of gastrointestinal fistula is external fistula. External fistula. In this case, gastrointestinal fluid leaks through the skin. It is also known as intracutaneous fistula or ECF. The fourth type of gastrointestinal fistula is complex fistula. This type of fistula occurs in more than one organ. Now I will talk about complications of a gastrointestinal fistula. A gastrointestinal fistula can lead to various complications, which include infection, malnutrition, electrolyte imbalances, poor wound healing. Around 25% of fistula will heal within 30 to 40 days with correct nutrition and some medical management. However, the mortality rate for all gastrointestinal fistula can be as high as 40%. As such, it is important for people to seek immediate treatment for this condition. Now I will talk about symptoms of gastrointestinal fistulas. When a person has a gastrointestinal fistula, digested food material can't move properly through the body. The fistula also causes a fluid to leak out, reducing levels throughout the body. Abdominal pain, dehydration, diarrhea, fever. Malnutrition, raised heart rate, vomiting. A person with a gastrointestinal fistula can become very ill and may develop a condition known as sepsis. This is where a person's body attacks itself as a reaction to a severe infection. Sepsis causes a range of symptoms such as low blood pressure, high fever, high heart rate, and organ failure. In some cases, it can even be fatal. In the end of this lecture, thank you for all.